Hey, thank you for joining the American Association of Kidney Patients for our 45th annual National Patient Meeting. Hi, my name is Chef Oliver Hale. A lot of you know me by Chef O. I am a two-time kidney transplant recipient with over 31 years of a successful kidney transplant. As a patient advocate, mentor, public speaker, a transplant athlete, and a retired internationally known award-winning healthy lifestyle chef, food and nutrition is no stranger to me. As a AAKP ambassador, I believe that patients should be fully empowered. Their voices should be fully respected in all care decisions, and that patients deserve greater choices in their care options that are available to them so that they can pursue their hopes and their dreams. Today is my great pleasure to introduce a man that I had the privilege of presenting with many times, Dr. Barry Smith, to speak on the importance of kidney nutrition. Dr. Barry Smith is a strong patient advocate and ally of the AAKP. He is also a loyal supporter of increased patient care and also believe that every patient, regardless of their background, have a voice and a choice care that must be respected by the medical professionals. He is current president and CEO of the Dreyfus Health Policy and Research Center in affiliation with the Dialysis Clinic Incorporated. Dr. Smith was convinced that chronic and end-stage kidney disease present a special opportunity to develop a better model for the management of chronic illness, and also committed his work to prevention of a kidney disease and his major work factors in diabetes and hypertension. His work expands beyond the walls of a building and also beyond the best in clinical care. And in research for treatment, he included population health and also community mobilization for better health. Dr. Smith has been a admired speaker at the number of AAKP national and international events, including the AAKP Policy Summit and the Global Summit, a collaboration between the AAKP and the George Washington University. It is my great pleasure and honor to welcome our AAKP friend and ally, Dr. Barry Smith.
I'm very excited to be here today to talk to you about one of the topics, nutrition and kidney disease, that I think is really the most important topic among many. And what I'd like to do today is give you some general ideas, put nutrition in perspective, because nutrition is not really about diet and restricting things. It's really about how to optimize the function of your body and my body. So that's what we need to do today. So that'll be a prime concept that we want to take through the entire presentation. So first, let's start with a question. What is the most important medicine we all take every day? Now, I think many of you will get this right away. Of course, it's the food we eat, because food is really a medicine. It determines so many things in our body, cholesterol over the long term, deposits in our arteries, and so forth. It's that kind of thing. And I think we need to take the concept of food, which is that medicine we take every day, as both medicine and fuel, because it's what gives us energy, but it also does a variety of other things to our bodies. And I think a very good way to think about the food that you eat in particular situations, you've got an entirely normal engine on the left-hand side here, and on the right-hand side, you have an engine that is a little different because it's involved with chronic kidney disease, or in some cases, end-stage kidney disease or renal disease, which is a more definite modification of the engine. And if we're going to do something about these two engines running properly, we need to adjust the fuel so that we maximize performance. Same thing you do at the gasoline station when you pick the low octane or the higher octane or the super octane, and you're matching that to the engine that you have and the manufacturer's recommendations, because you know, or you believe the manufacturer is right in saying that's going to give you maximum performance. And when we talk about nutrition for each of the things we talk about today, whether it's outside of kidney disease or inside kidney disease, we're picking the fuels because that particular fuel that we're choosing for a given condition is the one that maximizes performance. Our human body is really not much more than a finely tuned machine. It's maybe more complex than the machine in your automobile, the engine in your automobile, but in the end, it's the input determines what the output is, just how good it is. So if you put the right things in, you'll have an output which is feeling good, optimal mental and physical function, positive emotional state. And that's true whether you're talking about chronic kidney disease or cardiac disease, heart disease, or some other disease, or what's considered normal. So we've got to match the input and the output. When we talk about a kidney-friendly diet, that's a very important thing for the American Association of Kidney Patients. We need to focus a bit on that, and it's a lot of fresh vegetables, fruits, and juices, and we're going to talk a little bit more about that because now we're talking about, in the case of kidney disease, how do we maximize engine performance? The basic fuel components in all our food are proteins, carbohydrates, and fats. Fibers are really not a fuel, but can be important in our managing the dietary components we have. Now, the kidney diet is very simple, and I think all of you know about this. A renal diet or a kidney diet is one that is low in sodium, phosphorus, and protein. It also promotes the importance of consuming high-quality protein and usually limits fluids. Some patients may also need to limit potassium and even calcium. Now, the top kidney foods in terms of health are shown in this slide. Now, there's one thing you're going to notice about it, I think, very quickly. In this list, there are only two items that are really not fruit or vegetable. You can see here on the right, egg whites and fish, both which are good foods, but they're not fruits and vegetables. But the core of a really healthy kidney diet, whether it's a normal kidney or a diseased kidney, are fruits and vegetables. Very important to remember. Now, you have to be a little bit careful because there are some fruits and vegetables that we wouldn't think of this necessarily. Avocados, bananas, potatoes, and spinach are high in potassium. Green beans may be, citrus juices, and fish may be. And then there are other foods, but they're not in the vegetable category particularly, that are high in phosphorus, and they're not so good for us either when there's kidney disease in particular. So red meat is a problem. And of course, one thing that I don't think we think very much about is cola, Coca-Cola, Pepsi-Cola, whatever the cola is, because they are also very high in phosphorus. And when your kidney's not working right, those can be very damaging. And we didn't talk here much about sodium, but high sodium intake can increase fluid retention, overload the heart, thereby increasing blood pressure. And that's not good for us either. Now, one of the problems we have with our industrialized Western society diets very typically is that they have high ratios of acid-producing substances or proteins. Those are the red meats that produce those proteins, whereas the fruits and vegetables produce base-producing proteins, more like sodium bicarbonate and therefore we don't have the same acid loads. So in addition to the things we've already mentioned, we need to be careful to think about sodium, phosphorus, and acid load as well. So one of the interesting things in this regard was a study, and there are a number of studies in this area, but by Don Wesson, who is a nephrologist in South Dallas, Texas. And in his study, which was published in one of the nephrology journals, 1 year of fruits and vegetables or sodium bicarbonate in individuals. So you could just take sodium bicarbonate as a chemical. It's basic and restores base, but you don't want something that's very attractive to eat. But if you stuck to fruits and vegetables on a large scale for a year, and you have stage 4 chronic kidney disease, there is evidence of lower than baseline urine indicators of kidney injury. So that's very important. So not only are these nutritional substances, they can get us to the point of having kidney disease, but they can be important in controlling it once we do have it. So stage 4, which as you know is a late stage kidney disease, actually could be improved with a diet of fruits and vegetables and not with some expensive prescription medications. They may also be good for other reasons, but this is very, very simple. There have been many other studies just to reinforce this problem of acid in our diet as a problem in kidney disease. This is a summary slide of a review of 14 trials of metabolic acidosis or acid substances in almost 1,400 subjects, which showed that if you treated the metabolic acidosis, you could increase the bicarbonate and you would decrease the decline of the glomerular filtration rate. In other words, you're protecting the kidney. So not only with the fruits and vegetables, for example, could you increase the bicarbonates by 3.3, but you could decrease the negative effect of acid products on the filtration rate of the kidney by 3.3 as well. Now, there's some argument whether that protects you much against going on a dialysis machine. There is some evidence that it does. It doesn't particularly help in hypertension, which is the last column on the right. And one thing that I want to emphasize, and this is something that AAKP has done very well, is, again, staying away from this idea as nutrition as just meaning diet and taking away things that you like. You can, with careful planning and thinking about it and choosing the right foods, make the kidney diet delicious. And I would point you to AAKP's websites to see some of those recipes that you might find of interest. And I'd like to comment too, because we know that if you're on dialysis, you have to be fairly careful with your diet. But I want to come back to this point of using nutrition to treat kidney disease and keep us from advancing to that final stage where we either need dialysis or transplantation. And Dialysis Clinic Inc. has an interesting program called REACH, which is designed to keep those patients with stage 4 and 5 chronic kidney disease from going to dialysis, or at least to slow their progress to that state. And I liked very much what one of the dietitians at DCI REACH had to say, and she just said this to me recently. Before starting at REACH, I was so disheartened by healthcare. I often saw patients coming into the hospitals with conditions that could have been lessened or even avoided had proper nutrition education be instilled into their daily habits and lives. The word why circled in my head and so many times. Why are these patients not educated on nutrition? Why does this diabetic patient of 25 years not know how to count carbohydrates? Why does this cardiovascular patient not know the importance of following a heart-healthy diet. Well, there's a problem here, although I think Rachel is right to a great extent here, but she recognizes this. Just giving people education, giving them some facts about nutrition is not enough. Following up on this point of just education and giving out facts is not enough. REACH, which actually is real engagement, achieving complete health, as is spelled out on the slide here, means that you deal with the whole person. You take time to learn about personal lifestyle and habits. You can't just sort of say, here's a sheet on what you should eat and what you don't eat. We need to think creatively about what would appeal to somebody, what their cultural habits have been, something that they're going to eat, because if they're not interested in eating it, it doesn't do any good. So we combine active listening and motivational interviewing to engage that person in this process so that the individual himself or herself changes his or her behavior. And very importantly, there has to be trust, and that takes time to establish between the dietitian, the doctor, the nurse practitioner, and the patient. But particularly in the case of nutrition, trust is important with the dietitian. And also it takes perseverance, because these messages don't get through all at once. And one of the good things that happened is, I think we all have now available to us, is telehealth, so that we can go back without requiring someone to come into the office and take all the time that takes. We can reinforce the messages at home on a computer and do that frequently. So we need to do these kinds of things to make, because education, I would say again, is not enough. And we won't go through it, but DCI and other agencies that deal with kidney disease, the American Society of Nephrology, obviously AAKP, they all have nutritional educational topics. And as you can see from this list, there's a lot to know, and it's worth taking time to do that. And again, this speaks to the fact of not merely telling people about things, but engaging them in thinking about some of the sorts of problems we have. Right at the bottom of the list is something we don't think about very much. If you live in a poor neighborhood in a disadvantaged area of a city, the fact that you can't get fruit and vegetables is going to be a very important part of why you can't achieve some of the dietary recommendations that we have. So we may have to address a different problem there than just someone's desires or lack of desire. Very important, learn to read the label on the things that you buy at the grocery store. You can learn about fat, cholesterol, sodium. Remember how important that is. Total carbohydrates, which are sugars, and proteins, which are very important. We know if they're acid proteins or give rise to acids, that's not so good. One of the things you'll also notice on this revised label that has been approved by the government in recent years is the fact that phosphorus is still not on it, and yet to a kidney patient, that's extremely important. But read the label, be an educated consumer. The other thing that goes along with good nutrition, and I just want to mention this briefly, is that physical activity is very important. And here are some recommendations from the government. Moderate intensity aerobic activity, 150 minutes a week. That's the minimum. And at least 2 days a week of doing that. So you're talking about 2.5 hours, at least 2 days a week. That's sort of a minimum of 5 hours of physical activity. And you have to add that to the nutrition to make the good nutrition maximally effective. And just because we say, well, I don't have an opportunity to exercise, I can't do this, I can't do that, the important thing is to remember that there are lots of ways to get exercise. So think about it, things that you can do in your lifestyle that fit in with job requirements, whatever they are, but just think creatively about that. And remember this very important thing, the more you sit in one place, the greater your mortality is. You see that in the gentleman sitting in the chair on the upper left-hand side, whereas the person who is in the green is somebody who is doing moderate to vigorous physical activity on a regular basis. So good nutrition, physical activity, both very important parts of what you do. So the key concept I want to leave you with today is that good nutrition is also good medicine, and it is good therapy. We're putting these things into action, and you can in your own community and life, but in something we're calling the Central Brooklyn Health Movement, physical activity is a crucial thing, along with good nutrition, which we'll see in the next slide. But you can put all the other things together: disease prevention measures, early diagnosis, treating CKD properly. But right at the center of this, in this particular community, is a low-end community. Physical activity is important, and there isn't enough of it. There's a tremendous amount of obesity, is somewhere in the neighborhood of 30 to 40%. You don't want to have that happen. And the other thing that we've mentioned today, and was really our topic, is nutrition. So once again, I would say put physical activity together with good nutrition, and you're going to produce less disease, better survival, longer survival, I should say, and a better quality of life. Those are really important things. And nutrition and physical activity both can do a tremendous amount to help all of us achieve those things. And I'll emphasize as the final slide here, one of the things we're doing in East Central Brooklyn, East New York, 5 simple ways for a hypertension-free life. So you think about kidney disease, but if you think about diabetes, if you think about high blood pressure and hypertension, if you think about obesity, what are the 5 ways to fight it? Here we are again: physical activity, eating fresh fruits and vegetables, avoiding high sodium, salty foods, and very importantly, we need to lower stress. That's a problem. And read the food labels. So again, we're these smart consumers. Thank you very much, and thanks for listening. I appreciate it.
Thank you, Dr. Smith, for an excellent presentation. But before we conclude, I would like to ask you the following question. Dr. Smith, what role do you think kidney patient could have in encouraging food manufacturers and sellers to be more sensitive to kidney patient consumers and our needs as we buy online and in the grocery stores?
Well, one of the most important things that kidney patients as a group could do is get phosphorus added to that label that we saw. That was the one major item that's so important to kidney disease patients that's not there. Now, how do we do that? I think kidney patients have to come together through an organization very much like AAKP, if not in fact AAKP, to make the argument, to make a voice that's loud enough that the manufacturers will listen and produce perhaps a separate line of products that is more kidney designed, better kidney health designed, or get them to be willing to add the phosphorus content to the label. But whatever kidney patients do as a whole, I think acting with a single voice, coming together in one place, like this is the National Patient Meeting, 45th Annual National Patient Meeting of AAKP. It's those kind of meetings where voices are heard, but it's also being present at the American Society of Nephrology, at the Centers for Medicare and Medicaid Services. Wherever the patient voice can be heard, patients need there to be speaking about what needs to be done. And I give one very specific example, the Kidney Health Initiative, which is a joint effort between the American Society of Nephrology and the Food and Drug Administration, involves AAKP and so forth. That's a forum where a lot of these issues can be discussed. And I would just emphasize, everyone needs to look for places where they can speak out and join with other kidney patients to make the message loud and clear that the manufacturers could improve what they're doing so that the foods they produce and the labeling they produce are better for kidney patients, making it easier for kidney patients to meet the good nutritional standards that'll make their engines run at top performance.
Thank you, Dr. Smith. On behalf of the AAKP, we appreciate you taking your time to share your insight and your experience.